I am Dr. Vijayalakshmi Thanasekaran. I am a senior consultant and pulmonologist in Chennai. I had worked in the government institutions, I have worked in the private sector, and I have put in more than 50 years in the specialty of lung diseases. Okay, now let me talk to you first about the smoking and its problem and how our lungs are affected. In our body, we have so many organs and systems. The respiratory system is the most important because it is through the nose that you breathe in air, and that air contains oxygen which goes to the lungs and then into the blood and then goes to the entire body. So now you understand how important is your nose and the lungs, because the air has to get into your body through the nose, which should be open or patent. So if there is a block, air will not enter, and if the air does not enter, oxygen will not enter your body. When there is no oxygen, it won't get into the blood and the whole body will be lacking in oxygen. It will not function properly. So the respiratory system is important and it has to be an open system. Suppose you have nose block, you have sinusitis or running nose, we call it rhinitis, then there will be problem in the air to get into the nose, then to the lungs. Okay, after the nose, you will have the mouth and the larynx, we say the voice box. Then below that is the windpipe. And every one of you would have read in your school what the windpipe is. It is a tube which is open, and through the windpipe, the air goes into the lungs. Now, if there is a block either in the nose or near your voice box or in the windpipe, then there is a problem for the air to get in and also to get out. If the air does not get out, then there is a poisonous carbon dioxide gas which will be accumulated in the blood, and that will give rise to problems. So we need to have oxygen. We should not have carbon dioxide in our body more than what is necessary. So having understood that, I will tell you what are the problems that if you smoke either cigarette or chew tobacco or breathe in noxious air, what will happen to your windpipe? The windpipe will have so many layers which will swell up and block the air to enter the lungs. Once there is a blockage, the air is not going to enter, the oxygen is lacking. So how do we prevent it? We should see to it that the lining matter of the windpipe does not get swollen. Then the windpipe also has small muscles, smooth muscles, that should not contract. See, when you run, all your muscles, cough muscles contract, so you are able to do it. But here, this smooth muscle should not contract due to any reasons, because it will block the air. Third is the cartilage. That cartilage is something stiff, so that holds it. So suppose there is a swelling in the lining layer, or if the muscle gets contracted, then the airway is blocked. Hope you understand this tube, which should be open for the air to get. Now, what are the causes for this tube to get narrowed? One, your cigarette smoke, which contains noxious material, gases, and that irritates and causes swelling. Okay, next is chewing tobacco, that also causes. And if you are working in a dusty area, you see the masons, you see the building construction people, bricklaying people, everybody will be inhaling small, minute particles which we will not see with our eyes, and that goes and irritates this mucous membrane. So it gets narrowed, okay? And that's workplace. Then, that is, we call it, and we have been working for months, years together in the same area. So we call it a chronic obstructive lung disease, cold. Okay, chronic is long period, obstruction is narrowing, lung is the disease. So it could be due to all these causes. There is another thing called the bronchial asthma, where there is narrowing of the windpipe, but that is due to different causes. In addition to all this, there is, some family might have wheeze or asthma, or some medicines can give rise to asthma. So we have to be very careful, and whenever you get this sort, when you are working and when you are going to the doctor, tell what you are doing and tell the problems, how you experience it. Now, how will you go to the doctor with what problem? Cough, with or without phlegm, wheeze, that is noisy breathing, okay, that sort of breathing, or cough early morning or cough late night, or sometimes you don't take your food at the right time. There will be acidity in the stomach. That can give rise to all these problems. So that because there are certain nerves which will supply both the stomach and the lung. So once the acid gets, it irritates the lung. So all these things have to be taken. So you go to the doctor. Now once you go to the doctor, now I'll talk only about the smoking, and with a wheeze or a dry cough, you go to the doctor. What the doctor will do? He will ask you to do a lung function test and see or assess the capacity of your lung, whether you can breathe well. If you cannot breathe well, what should I give? Should I give medication like inhalers or tablets or nebulization? So the doctor decides, and you have to follow the instruction of the doctor, which is very, very important, because for some people, inhalers might not agree. For some people, tablets might not agree. For some, they might give steroids, which will give good protection, but how long to give us? All this, your doctor has to decide and tell you. And you as a patient, it will be good if you can follow. Now, since you have been a long-term smoker, your lungs would have shrunken. And that is a major problem for all of us, because you come in a severe state. And what are we supposed to do? We will give you medicines. We will advise you to do breathing exercise. We will advise you to take good nutritious food. We will advise you to periodically have a checkup. And once you get some infection, you will have to see the doctor. And COVID period was the period when we were asking all the people to have a pulse oximeter. And if you can afford one, and if you are a chronic smoker with having chronic lung disease, I think if you have a pulse oximeter, and if that shows that your oxygen saturation is low, go to the doctor immediately. And rehabilitation is very, very important. You have to do your breathing exercise. You have to take good nutritious food. You have to use the inhaler in the proper way. Do pranayama and stop smoking. Stop. Cessation of smoking is the first thing that we will advise. And what will happen is, they will tell the wife or the mother or somebody, I've stopped. But I tell you, it's very difficult for them to stop. So you have to have a willpower to stop it. Once you stop, the progression of the disease is stopped. But whatever damage that has been done earlier cannot be reverted. Don't think that your doctors or magicians or gods or goddesses. Damage done is damage done. Further damage will not occur once you follow the doctor's advice of taking the medication, stopping the chewing tobacco or cigarette smoking, all those things. And of course, once you become emotionally upset, I think what I will suggest is, as far as possible, avoid the psychiatrist. A counselor is the best. Go to a psychologist. The psychiatrist will immediately dump you with the antidepressants. Do not be scared of anything. Change your lifestyle. Lifestyle modification is important. Take your food at the right time. And early dinner. After the dinner, at least 2 hours you have to be there. Then go to bed. These are some of the lifestyle modification which will help you. and breathing exercise and all those things. And my advice to you is, when you have a chronic obstructive lung disease, meet the doctor, follow the advice. Particularly the rehabilitation is very, very important. And you will be having a good life after you stop smoking. Same way, if you're working in a dusty atmosphere, try to avoid it. But if you cannot avoid, and usage of masks is the best. And during the COVID period, people never came with V's because they were using masks. And that's the advice that I can give to all of you, all the smokers or people who are exposed to dust and other things. Okay?